Welcome again, everyone, to our Public Health Town Hall meeting. It is my pleasure to introduce Dr. Monique Cedric, our Associate Dean of the Faculty of Health Sciences. It is really a pleasure to have you, Monique, Dr. Cedric, here in the Town Hall meeting. So I'm just wondering if you would like to introduce yourself and welcome our group. Thank you.
Thank you, Nimesh, for the introduction. Welcome, all of you, to the University of Lethbridge and to this Zoom meeting and to the Faculty of Health Sciences. We're really looking forward to working with you and to meeting you, and hopefully at one point in time in the near future, hopefully, even face-to-face would be absolutely lovely. But in the meantime, as we're dealing with this pandemic, I really appreciate that all of you have taken the time out to join us through Zoom. And I hope that we're able to answer your questions. And I know that my colleagues have worked very, very hard and continue to work hard to make your fall start a really exciting one, an engaging one, and a very meaningful one for you. You're very lucky to have the caliber of teachers that you're going to be engaging with throughout this program. Again, welcome, and we'll try to answer. So thank you again.
Thank you, Dr. Sedgwick, our Associate Dean. Welcome everyone to our public health program. It's really exciting. I cannot comment enough that the timing couldn't have been better to study public health as we are going in the midst of the pandemic. It's really valuable. I think the whole world has recognized the importance of public health and how it affects the population health at large. So it's really great timing, at least in my opinion, to study public health and build your career in. I definitely anticipate that there'll be more career opportunities in public health moving forward as we come out of this pandemic slowly. We will have a separate orientation session near the start of the fall semester. So I'll say more introduction to the formal introduction to the program, different options in the program like the practicum co-op as we move or in the orientation session. But the intention of this session today, just to keep the session as informal as we can, and also just to open up the group about any questions that you may have as you join the program, as you also join the university as well. So I don't have any specific PowerPoint presentation, but just thought to introduce to the public health program. We have a different undergraduate programs in public health. We have 4 years degree program, a Bachelor of Health Sciences with a major in public health. We also have a combined degree with four-year combined degree with management as well. And we also have a 2-year post-diploma as well as after degree program in public health. So I know some of you may be in different programs, and there will be different opportunities depending on the program that you are in. But we are very excited to welcome you in our public health program. We always love to interact with our students. The whole faculty love to interact with our students. My name is Nimesh Patel, and I will introduce myself. I am the program coordinator for undergraduate programs in public health in the Faculty of Health Sciences. I have a background in medicine, so I have an MD. I graduated from medical school in 2010, I believe, if I recall correctly. But after graduating, I did practice as a physician in Emerge for about a year, as well as some in clinical trials. But based on my experience in Emerge or interacting with patients, I did realize I found my passion in public health. I really thought that I could use my skills a lot more better in public health than medicine. So sometimes I think, in my opinion, I know some students some students choose public health as a backup options after for medical school or nursing or the clinical programs. But I know some people like me who have chosen public health over clinical career as well. I cannot emphasize enough how much passion I have for public health, how much I love public health. I cannot imagine myself working without public health. It's an amazing field. I have an experience working with clinical medicine as well as public health and just combination of that itself is amazing. But I hope you, once you start your program, you'll see how great public health is. This the field of that we are, or you are going to study for the next 2 years or 4 years. It's going to be phenomenal, and the skills that you, it's not only makes you, or it's not for career oriented as well. It makes us informed citizen, as well as it also helps you making the healthy choices for our own as well as the loved ones' lifestyles as well. So it's very important program. I'm very passionate about public health, and as a program coordinator, I would be very happy to support you as you are going through the program. We have a great faculty here, some of our great faculty here today in the session, and I would like to give an opportunity to introduce themselves, as they would be teaching some of our public health courses, and you will see them in the program as well. So maybe probably if we can go with what would I see, Julia, if you could introduce yourself.
Sure. Can everyone hear me okay? Great. So I'm Julia Brasilato. I'm an assistant professor here in the public health program. I hold an Alberta Innovates Research Chair, which means that I have a reduced teaching load right now, so you won't see me too much in the next 2 years, but the 2 undergraduate courses that I teach are Health and Society and Policy and Health. So my background is in health policy and equity, and prior to that, it was in philosophy and bioethics. So that's kind of the worldview that I bring to that. I'm really interested in those ethical issues that inform our thinking about public health. And yeah, the societal context, and as Nimesh mentioned, in the context of the pandemic, our students last year, or last term, I suppose, feels like a year ago, we're saying this feels like a really unfortunate experiential learning opportunity. Like all the things we're learning about in our classes, we're just seeing play out in real time. So I'm really looking forward to getting to know each of you, probably in the second year courses, so next year. But welcome to our program, and we're excited to have you.
Thank you. Richard?
Hi everyone, can you hear me? So I'm Richard Laroche. I'm an assistant professor in public health. I hold the Board of Governors Research Chair from the University of Lethbridge. And like Nimesh was saying, I come to public health from a different discipline as well. So I did my undergrad in kinesiology with minor in psychology. And then I went to do my master's and PhD in human kinetics. And for most of my graduate studies, I studied physical activity from a public health perspective. And so I've been doing research in public health for the last 12 to 13 years. And so this brought me to this position here in Lethbridge about 3 years ago. I teach a couple of courses in the undergraduate programs, so population health, which is typically a second year course. I also teach research methods, and in the past I've taught health promotion. And as we've all had said, I look forward to see you virtually first this semester, but hopefully in the near future in person as well.
Thanks, Richard. Karina?
I think she's just
Yeah.
for childcare.
Cheryl?
Hi everyone. So I'm a social epidemiologist by training. I've been at the university as a faculty member now for 8 years. I'm an associate professor of public health. I teach epidemiology and advanced epidemiology at the second and fourth year level. I am also a research chair, so I only teach 2 courses a year, but I look forward to seeing all of you in epidemiology. I have an active research lab called the Social Epidemiology and Action Laboratory. You can check out our website. So we're quite active, lots of ongoing studies, both experimental randomized trials, as well as a number of different observational epi studies. So yeah, I employ a lot of students who are looking for that hands-on research experience in epidemiology, as well as teaching the field. So yeah, I look forward to meeting all of you.
Thanks, Cheryl. Karina?
Hi, everyone. Sorry, I had to run off. The little one was having a tough time. My name is Karina Zhu, and I'm an instructor with the Public Health Program. My background is in nursing. I have my RN from the U of C, and I practiced just like Nimesh clinically on MedSurg for a few years, and then was working as an outreach nurse in harm reduction, and then did my graduate work in public health at the U of A. And then I joined the university in 2017. I think I probably will see it, depending if you're on the Calgary campus or the Lethbridge campus. I probably will see some of you at Public Health 1000 electronically in the fall. I also teach a second year course with Julia when she's not doing it. She tends to do the in-person one. I do the online one. That's Health and Society 2700. And then I also do health promotion, which is a 3000 level course. So that might come in your second or third year, depending. Other than that, life is kind of hectic with a 2-year-old. But yeah, I'm sure you're all facing different challenges with elder care and childcare. So looking forward to meeting all of you, and yeah, in person or electronically.
Thanks, Karina. In addition, we also have Dr. Brenda Leung, who unfortunately couldn't join today, who is an expert in nutritional epidemiology, as well as Dr. Sylvia Coso, who is also an expert in program planning and evaluation as well. We also have Dr. Ali Walker, but who is currently on mat leave, but she would be joining us soon as well later in the year. So we have a very, as you heard that, and I also myself has an expertise in environmental occupational health along with infectious disease. So as you have probably noticed that we have a very, because the public health is a multidisciplinary field, we also have a faculty who has a very diverse sets of skills and competencies in different areas of public health. So you, as a student, that's great. You'll have so many opportunities to engage in different fields of public health. As probably you see or notice right now in the world, what is happening is just one part of public health, that is infectious diseases epidemiology. If you hear, but there are so many different other aspects of public health that goes in function as well. Like for instance, climate change. I'm speaking from my own experience. Environmental public health. That's another important thing that we all should be talking about, right? So that's amazing. It's always a pleasure to see our medical officer of health constantly in the news, chief public health officers. That represents what public health professionals can do and how much importance that they have in the community. So it's great. It's pleasure to have all of you in the program and be part of our journey for the next 2 or 4 years. I would like to open the group. I know it's being recorded, so I'll leave that to your comfort level as well. But just as an icebreaker, probably, I know there are a few students here joining the session. If you'd like to or comfortable introducing yourself, as well as which program you are in, and have you noticed public health in the past 6 months, and why you decided to join public health? Maybe something along the lines. So I'll open the floor for the participations from the students, if anyone is comfortable. Just so that you know, you are not going to be graded.
Hello, Nimesh. Can everyone hear me?
Yes, very well.
Okay, awesome. Well, my name's John, and just like Karina, I come from a nursing background, and yeah, I can definitely say we've noticed the effects of good and bad public health policy uh, for most of the year now, and just the ramifications of what it is and what we're training to be responsible for coming through. I got into public health because I'm using it to advance my nursing career as well. So I'm planning to go for the after degree RN program once I get my public health bachelor's. So yeah, it's something I have fun looking forward to blending. Just that background and public and community health is always something I found I quite enjoyed when I was in my practicums.
That is wonderful. Thank you for sharing, John.
I can go next if that works. I'm Christina. I am going to be in the after diploma program starting in the fall. Historically, I am like Karina and John. I have a background in nursing. I actually just finished my LPN this April in midst of COVID-19. And so prior to that, I've been working as a healthcare aide for the last 6 or 7 years now. So primarily right now I work very similarly to Karina in addiction and mental health. And so my hope with using my degree and all of the skills that I've learned is to kind of go at that sector with more of a health promotion view and utilize those skills in order to connect a lot of our vulnerable populations to the services that they need. So yeah, that's my hope, but really excited, super stoked to meet all of you. So thanks so much for all of that.
Thank you, Christina. We also have a student introduce herself in the chat function as well. So I'll recommend everyone to go through the chat function. I'll not read out the names because it's being recorded. Nice meeting you as well. Any of the students would like to introduce himself or herself? I know that from medicine point of view in Canada, particularly Medical Council of Canada has put a lot of emphasis on training physicians with more expertise in public health. That is a sure that I know for. And I'm assuming that will be the same for nursing and other clinical professionals as well. I think it's as what we are going through. It has really emphasized the importance of having a clinical expertise along with the public health expertise, and combination of that. It's important for promoting your population health. So that is an amazing to see some of you who are in nursing background and came here to gain more understanding in public health, which is amazing. Any other student would like to introduce? Okay, we will move on. Again, I would like to thank our faculty to be here in this important session. Again and again, you will see them teaching some of the courses as well. And again, we will have an orientation session as well. So before the start of the session. So again, we will there provide more information about the program in specific as well. But again, just thank you so much for being here, the faculty. If you have other commitments, feel free to log out, or you're also obviously more than welcome to join, stay in the meeting as well until the end. On the next, I would like to invite Janelle, our Lethbridge campus academic advisor, to introduce herself and also guide you through some important information and resources. Janelle?
Thank you, Nimesh. Hello, public health students. I have a little PowerPoint here. I'm going to send this out to everyone. It has important links on there to go through. Okay, so I am the academic advisor for the Faculty of Health Sciences, and I'll be with you until the end of July, at which time Tara Frolich will be returning from a maternity leave. So she will be your academic advisor. She's fabulous. She's much quicker at answering questions because she doesn't have to look everything up like I still do. So the face and the name will change, but you can contact us the same way. So our Faculty of Health Sciences has a student advising site that I highly recommend everyone check out. There's a lot of important information on here. Oh, first I should say what I do. So as an academic advisor, we help out with program planning, stuff like course selection, course sequencing. You'll notice many of your courses are only offered once a year, so you'll want to be mindful of the order in which you take your courses. One thing an academic advisor is not is a mediator between students and instructors. So if you are having an issue, we're happy to lend a listening ear, but our advice to you will almost always be talk to your instructor about what the issue is, and then talk to the program coordinator, or just talk to the program coordinator if the nature of the issue you cannot talk to the instructor. And then to talk to Dr. Sedgwick, the Associate Dean. One other issue we can help you out with is called a final grade appeal. If you're unhappy with a mark that you've received in a course, talk to your academic advisor. And the only reason I mention that is because there isn't a link to it on this page. So always know that that is an option for you. You can find links to almost any form you will possibly need on this page. If you want to withdraw from a course or do an independent study, all of that information can be found on this page. And speaking of withdrawing from courses, some advice from an academic advisor is that you should never fail a course. And I know that sounds like very obvious advice, but what I mean is students are able to withdraw from a course up until the last day of classes. So usually, if you're going to fail a course, you'll probably have an idea by the last day of classes that that's going to happen. And I strongly recommend that you withdraw from the course rather than take an F, because a withdraw does not affect your GPA, whereas an F on your transcript does affect your GPA. So if you have any questions about that, please reach out. You can find important dates and deadlines here on the academic schedule. Things like when is ad drop, when can I find out when I'm able to register for my courses, that kind of thing's on there. Now, another really important website is the Registrar's Office site. So this site can answer probably 95% of any questions that you might have. How to register. It will walk you through step by step how to register, how to find the timetable, how to read the timetable, what's a CRN, where do I find the CRN, what's a prerequisite, how do I know what courses have a prerequisite. That'll help you out on there. Liberal ed requirements are confusing, and so there's a link on here as well where you can learn about why you are required to take courses that you feel have nothing to do with what your major is, and why it's important that you take courses that are outside of the box and beyond what you would normally choose. You can find all of that on here. I really encourage everyone, just in life, if you see a button that says learn more, click it. Who doesn't want to learn more? But on this page specifically, because it will lead you to useful terms. For example, I think a lot of students come into university and they just feel like they should know what everything means already, but it's all brand new, and it's very normal to not know what a faculty is. So this page can be very useful. It'll tell you what different things are and what they mean, what the difference between credit hours versus courses. Say you take 3 courses a term, and then you're trying to sign up for your second year classes, and it's telling you that you're not a second year student yet, and you're like, well, I was here last year, but technically you're not a second year student until you've taken 30 credits or 10 courses. So it explains all of that in here. Speaking of faculties, so you're in the Faculty of Health Sciences, and the courses that we offer will have the subject code of public health or health sciences or Aboriginal health, addictions counseling, that kind of along those lines. Now, you'll notice under your major requirements on your program planning guide here, that you have some courses, well, two courses that are, three, are not offered from our faculty. So you will be taking courses that are from other faculties, just so you're aware. Now the program planning guide, there's a link here to the program planning guide. Now this is one for a student in the 4-year program. So basically, yeah, you complete all of your major requirements. They're listed on there. There's certain lib ed requirements you have to complete. Now the 3,000, 4,000 level courses. So these are any 3,000 or 4,000 level course that our faculty offers, and those are the subject codes there. So that's Aboriginal health, addictions counseling, public health, health sciences. You have a lot of open electives, which is really a nice thing about the public health program. If you do decide to do a practicum, your practicum will take up 5 of those open electives. So save those for last, because you might think you're doing a practicum and change your mind, or you might not think you're doing one and change your mind. So save 5 of your open electives for the last term. And speaking of those open electives, I like this site, and I included the link because it can help you when you're trying to decide, well, what do I take? How do I use those electives? So this can kind of help you if you kind of know which area you're wanting to go in public health, but you'd like a little help planning your program guide around that. Just click here. So the area 1 would be for health promotion. Health promotion program development. Click there and it'll give you a list of suggested courses that you can fill up your electives with. Oh, I included a link to this page. This is for when your parents or grandparents are saying, what are you going to do with a public health major? You just email them this page and it will tell them the skills you develop and all the different jobs that you can have, and it's all written nicely on there, related job titles. And then if you'd like to go on and do more schooling, it has a bunch of very helpful links on that page as well. Okay. Oh, another thing about the registrar's office page is there's a link on there that will tell you how to access your transcripts. Now you can look at your transcripts anytime, but just so everyone is aware, your transcript is a historical document of your academic record. So you'll hear about substitutions and that sort of thing. For example, let's say you get a D in Public Health 1000 and you take that course again the next year and you get an A. Only the A grade will be counted towards your GPA, but that D on your transcript, Public Health 1000 D, will still be written on your transcript. It's not a true substitution. So any course you take, it will be on that document and remain on that document, just so you are aware of that. Okay, now, the program planning guide, one more thing. I know it says sample sequencing plan. Let's all just pretend it says highly recommended sequencing plan, because really, if you can, please stick to this. It has each course in the correct term that it's offered. Public Health 4000 is only offered in the spring, and if you follow your plan, there won't be any issues with that. Textbook reservation, you can follow that link if you want to reserve your textbooks. Counseling services. So this is a free service. It's not free. You already paid for it with your tuition. So I recommend that you utilize it. It will benefit you to learn healthy self-care habits now, but also depending on where many of you work in the future, you'll be working with vulnerable populations, and it will be useful for you to understand what it feels like to walk into an office and tell your story and be open and vulnerable in that way. So I really recommend all of our students access our counseling services, and they also do career counseling there as well. So The sexual violence support and information, I included that link because it's a different page to the counseling services. Lots of information, support on there. And our sexual violence crisis worker at the university is a graduate of the Faculty of Health Sciences, and she does a really wonderful job. So check that out. You Volunteer Lethbridge. This is a really great link, and Nimesh was talking about this last week, and it really, you know, got me thinking about how, if you can, I know many of you are working and busy and whatnot, but if you can, really make the most of your time at university and volunteer, get experience, make community connections, and yeah, this is a really great website because it lists volunteer opportunities not only by site or by area, but also by hours, like volunteer hours required per week. You can type that in and then it'll generate a list for you. So that's a really great website. I just added this Bachelor of Nursing degree after degree link after John mentioned that, because I know many of you will probably be thinking about, we call it BNAD, if you ever hear that acronym. It's Bachelor of Nursing after degree. And I recommend you speak with our nursing advisor at some point in your third or fourth year of the public health, if that is the route you're going to take, and you can find her contact information under academic advising. She can let you know, maybe you're like, should I do a practicum or should I do courses to increase my GPA? And Sherry will give you some great advice about that. But one more thing is the academic calendar. So all students and faculty are bound by the regulations and policies contained in the academic calendar. It's big and hefty, but there's a lot of really valuable information in there, and I highly recommend you browse through, take a look. All the courses are listed on there. The timetable isn't, but the courses are, and the prerequisites, and it just explains a lot of the policies and whatnot that you might need to know. And I think that is everything that I wanted to cover. So feel free to ask questions. I cannot stress that enough, that there really are no dumb questions, and you may be in your third or fourth year and think, well, I should know that already. No, you shouldn't. And, you know, be kind to yourself. Ask your academic advisor. If we don't know the answer, we'll point you in the right direction. And that's all for me.
Thanks so much, Janelle, for putting this important, very important information together. I would echo what Janelle said, that I know that program planning guide currently says sample sequencing plan, but it is going to be changed with the strongly recommended sequencing plan. Just to get the base experience out of it, I recommend all the students to see the academic advisors at the beginning of the program. That way, the students can plan their program a lot more better. Because in my experience, I have seen some students, they never see the academic advisors, and then they suddenly don't meet the prereq of some of the courses that they need to take, and it ends up being extending the graduation. So I think it's really important to see academic advisors to even plan out your optional practicum as well as co-op as well. And again, we will talk about the practicum and the co-ops a lot more in orientation session, but I'll be very happy to welcome the questions on that at this point as well. So thank you, Janelle, for putting this together. Maybe I'll share that that's a PowerPoint screen to all the students in the email as well, so you will have an access to those very important links to the resources. Next, I would like to invite Chris Singlesia, who is our Calgary campus academic advisor. Chris?
Hi, everybody. Nice to meet you. I think Janelle pretty much covered the basis for all the academic stuff. The only thing I really want to add in is don't listen to your friends. Everyone's program is a bit different. So depending on your previous education, degree, diploma, there might be substitutions made in your program that aren't the same as your friends. So just don't listen to your friend. Come and see your advisor. We're there to support you. We're there to work with you. On the Calgary campus, we offer the second degree program and the post-diploma program as well. So all of the services that are available to students in Lethbridge, Calgary students can access those too online, which we're all getting really good at right now, is doing things virtually, doing things online. So anything a Lethbridge student can do pretty much, you can also access that online. We do have other services for Calgary students on campus as well, but for the fall semester, our campus will be closed entirely, so everything will be virtual. But we are there to support you still. We are there to work with you. Like Janelle said, if you have questions, ask us. If we don't know the answer, we'll be able to point you in the right direction of the person that does know the answer. And we can't wait till we can Calgary on the campus. The Calgary campus is unique. It is smaller. So we all get to know each other really well, and that's nice. But yeah, we're looking forward to seeing you there, and follow the calendar, follow your program planning guide, listen to your advisor, and just take advantage and enjoy your degree. It's an exciting time, and like Nimesh said, it's a really exciting time in public health too. The other day, the other advisor and myself were talking to Nimesh and Janelle about public health, and they made us want to go back to school and study it. So lots of exciting stuff going on. It's a great career. So we wish you all the success, and thank you, Janelle, for going over all that academic stuff that I don't have to now repeat. And yeah, welcome everybody. So we can't wait to see you on campus, and email us calgary.advising@uleth.ca. And if you are on the Calgary campus, we are going to reach out to you as well, to every student, and just ensure that you don't have any registration questions, have your correct program planning guide. So if you have not yet received an email from us, you will be in the next week or two, and feel free to pop us an email as well. So that's it. Thank you very much, Nimesh, for putting this together too. It's nice to welcome everybody. So thanks, everyone.
Thank you so much, Christine. We also have Imaru Bekuro from International Student Services Office. Imaru, if you could introduce yourself and provide some information for our international students.
Yeah, hello everyone. My name is Imaru Vaquero. I am the manager of International Student Services at the university, and I work at the International Center. My first question would be, are there any international students in this call? If you can use your participants window and just use the button to say yes, or if you rather write it on the chat, or if you want to put your hand up, like anything, I just want to know. Oh, I see at least one of our students is an international student. I see a hand. I'm going to lower that hand now. And then, so I guess hopefully there's more of you that are international students, but I'll provide the information I wanted to provide to Infinix Hot 8. I am not able to share the screen. I had oh, now I am for some reason. I guess someone just gave me access.
Yeah, I just gave you the access.
Thank you. I just wanted to, I have a very short, can you see my screen right now? Yeah, just two slides. One, in the call with me, it's Claire Broderick here. She's an international student advisor and also a registered international student immigration advisor. Both of us, Claire and I, are able to provide immigration advice to our students and to our new students, and also to our applicants, so or accepted students. If you need anything, contact us in that regards. I have some information. Oh, if I can move the slides, for some reason not moving. Oh, there. So we work at the International Center. If you have any questions regarding your immigration, coming to Canada, study permit application, anything regarding that, or even the journey to come to Canada once you are able to, please contact us at the International Center. Our email for you would be international.new@uleth.ca, and you probably have received a few emails from us from that email already. So international students need a study permit to study in Canada, but because you are doing your courses for the first semester online in the fall, there's a possibility for you to start your program without a study permit. I just want to make sure that everyone knows what are the negative consequences of doing so. If you are doing a program that could be, it's 2 years, let's say you're a post-diploma student or an after degree or a transfer student that is going to be completing this program in 2 years, then it's highly recommended that you have a study permit in order to start your program. Before you start your program. And the main reason for that is that the government of Canada they made a temporary policy change in their policy for the post-graduation work permit that allows students to start their program from outside Canada on a study permit and still be eligible for the same length of the post-graduation work permit that they would be eligible for. So if you have a study permit and you start from outside Canada, your post-graduation work permit eligibility will not be affected. However, if you have a program, if you are doing a 2-year program and you do 1 semester outside Canada without a study permit, then your eligibility for that post-graduation work permit will be significantly shortened. For those students, I don't know if all of you are aware, but if you complete a program that is 2 years or longer in Canada, an academic program that is designated for post-graduation work permit, your post-graduation work permit would be, the length of that permit would be 3 years. But if you complete a program that is shorter than 2 years, the length of your permit is the length of your program. So that means that in the case of students who are completing a program for 2 years, if they do 1 semester outside Canada, then you may end up getting a post-graduation work permit that is only 1.5 years if you start that 1 semester outside Canada without a study permit. If you have a study permit, your post-graduation work permit eligibility will not be affected. The other thing is that there's other things about the post-graduation work permit. So to be eligible for a post-graduation work permit, you have to complete at least 50% of your classes, of your class time, presentially, so in person, face-to-face, not online. So once you take your first semester in the fall, which will be online, once you're eligible to come back to Canada, we recommend that you're very careful with the number of courses that you take online in Canada. You have to make sure that your total number of courses for completion of your program that you take, out of that total, at least 50% are done face-to-face. If you have any questions about that in the future, please contact us and we can talk about your specific case. I also wanted to say that because the public health practicum is an optional practicum, unfortunately, international students are not eligible to complete that because the government of Canada requires that you have a special permit to do practicums, and that special permit is only given to students whose job placement is a mandatory requirement to graduate. If you have questions about that, once that time comes, please come talk to us. Once you're hopefully eligible to come to Canada to study, and some of you may already be eligible, if you obtained a study permit, if your study permit was already approved before March 18th, you may be eligible to come to Canada. However, you have to meet the requirements of the travel restrictions exceptions, which would be having a study permit approved before March 18th. But you also have to meet other requirements of the Canadian Border Services Agency, and that is that your travel to Canada is deemed essential. And since we are offering classes online for the fall, the officer may not think that it is essential for you to be in Canada to do those online courses. So I just wanted to also you to be aware that before you make plans to enter Canada, you contact us and as well to talk about that and to talk about whether or not you'll be able to enter the country for the fall term. And then for those who are eligible to enter, and I am thinking that even if travel restrictions were to be lifted for the spring term, there's probably still be a quarantine requirement. And it is a responsibility of the person who's coming into Canada to make sure that they have a quarantine plan for 14 days. And we can also help you understanding what those requirements are and help you make that plan. That was all that I had. If there's any questions, I will be happy to answer them in the chat while the rest of the session is going. and Claire as well will be available to answer questions. Thank you.
Thank you so much, Imaru.
Yeah,
we strongly recommend you to international students to see the International Student Services offices before to get more information, as well as plan their arrival in Canada for sure. It's strongly recommended. Now, that's it from our. I think I would like to use the remaining minutes of the sessions to address any questions that the students may have. Feel free to unmute your mic as well as use the chat function as well.
I suspect this will be more applicable for Kristen to answer since I'm attending the Calgary campus. But are we just registering for classes as normal and they're all going to be switched online? And we'll hear from the instructors closer, maybe after the orientation date? Or because I notice now that there's a separate online delivery in the ad drop courses. So just wondering like how we go about registering for courses, and just like a lot of them are still TBD, so I can't really plan out the schedule yet. So are we still working on dates and instructor assignments and times?
Questions. It's been complicated, I guess you can say, trying to switch everything over. So some of the courses were originally scheduled to be online, and those no changes had to be made. So those are still online. The other ones that were in class, they won't officially be flipped to online, but they will be online. If there is a day and time in the timetable, that means that there's asynchronous learning, and you will have to be present for those days and times, like meeting online with your instructor and your classmates. If there are no days and times listed, that means it's just an online course that you can do at your convenience. Does that make sense?
Yeah, I think so. And
Okay.
when you reach out, if I have any more specific concerns, then we'll probably be able to discuss it.
Yeah, absolutely. Please email me if there's a specific one you're not sure about, and I'm happy to set up a Zoom appointment with you after as well. We're doing Zoom advising all semester, so I'm happy to connect with you one-on-one too, and can run over your schedule and everything and make sure that everything looks good.
Sweet. Thank you so much.
Yeah, thanks, John.
Yeah, Monique.
Perhaps, Kristen, hopefully I'm not giving the wrong information, but to extend a little wee bit on what John was asking about, the registrar's office is working on making sure that the timetables are changed over according to what the courses will look like in terms of the delivery for the fall. And they're working on that. It might take a couple of weeks until you see that change officially on the timetable, because of course they have to do the whole university. So, and I think that they include Calgary campus, but Kristen can correct me on that one if I'm wrong.
Calgary campus will be treated the same as the rest of the university, is my understanding.
Yeah, so the short and long of it, John, is keep checking.
Understand. Thank you so much. And we'll keep checking.
Thanks, John, for asking the question. Any other questions?
Hello? Hello?
Yep, we can hear you.
Yeah, I realized that nothing was said about student loan. Like at this time, how should we go about it? And then if we want to know, if somebody wants to know about the total cost of their books and all the courses that they've chosen already, like the cost that the total cost that you incur during that semester, like where should I be able to, which link should I go for me to be able to see that?
I think Janelle has shared a link in the chat box. Janelle, do you want to add something?
I shared a link on there for the scholarships and student finance page. There is another link, and I'm going to find it right now, where it'll give you more detailed financial information about your term. But anything to deal with finances or tuition or anything like that, you want to direct that towards the scholarship and student finance office, because yeah, advisors don't like to talk about, we just don't want to give any misinformation. So I'll go to that link there, but I'll also find the other one and include it as well.
Thank you.
Thanks, Christina. I think we have a student asking the question in the chat function. I'm entering the after degree program in Calgary. Now that both campuses are online, would we be able to register in a course that would be normally offered at the Lethbridge campus? And my answer is yes. I think students, because we have switched to online, I'm sure the students would be able to register in any courses that is offered either at Calgary campus or the Lethbridge campus, if the course has changed to the online delivery method. And that is true for the most of the health sciences courses. And that is true for the Lethbridge campus students as well. If the course is offered online at the Calgary campus too, the Lethbridge campus students also have access to those courses as well for the fall semester.
Hi, I have a question.
Yep.
Okay, can you hear me okay?
Yes, absolutely.
Okay, so I am planning on taking a couple courses this fall, but I'm a transfer student from Edmonton. And from my understanding, like I'm able to enroll in a couple of classes, but I'm just curious to know if I do decide to go forward with taking, like, say, 2 classes, would there be any like drawback that I wouldn't be aware of in terms of going forward with that decision?
Sorry, so if I understand the question better, so you're transfer students and would like to enroll in 2 courses in the fall, and you're just wondering if there are any drawbacks to
Yeah,
that?
like I'm just trying to make a decision. Like I think it would be a good idea for me to take a couple of courses, because I didn't have planned to go to Lethbridge, but because of COVID, I decided, okay, maybe I'll stay here in Edmonton and try a couple of online courses instead. But I'm just trying to like also weigh my pros and cons. So if there's any like cons that I wouldn't be aware of in terms of going forward taking classes, if that makes any sense.
Yeah, I cannot think of any cons for that. Maybe Janelle?
Hi, Trish. How are you?
Good. How are you doing?
Good.
Good.
Yeah, I can't think of any either. I mean, there could be student loan implications if you're not a full-time student. A full-time course load is 3 courses, but other than that,
Okay. Yeah, because I was just like curious about, say, for instance, accessibility with the professors or something like that. Like I know maybe for some students, they might be able to see them face to face, but I think for the most part, it's probably just going to be all online anyway.
yeah, a lot of Zooms. So you'll still have access to your instructors the same way that any other student will right now, email or Zoom.
Okay. And also one other thing, is Zoom the primary platform for most of the online courses, or is it going to be different for some courses?
No, it will be Zoom for all of the courses there, but it really depends on if it's a asynchronous delivery or the synchronous delivery. But if the instructor is using the platform, I think it will be Zoom.
Okay, good to know. Thank you.
Yeah, because we don't want students to learn all different softwares for all different courses. That would be a nightmare in already challenging times. So
that makes sense. Thanks.
Thank you. Any other questions?
We had oh, sorry.
Yes, go ahead. I was just about to mention that if I had a student asking in the chat box that if the session is being recorded and will be posted on the website, so that the students can find the information that they may have missed in the session. Just to clarify, yes, the session is actually being recorded, and we will post that on the website. And once it is posted, I'll share the link to all the incoming students as well, so you can go back and revisit the information in the session. Yes, John, go ahead with your question.
Okay, slightly off topic, but why Zoom as a platform, especially with the IT services upcoming switch to the Microsoft platform? Wouldn't it make sense to use the Teams that is native to everyone?
Excellent question, John.
Yeah, I'll try to answer that, John. I think that probably back in March, where not all students had been migrated to Office 365, Zoom made the most sense. It was the easiest in terms of user-friendly, and I think that know how to use Zoom now, and I think that it was just, let's just make this a little easier for everybody. I understand that Microsoft Teams is relatively easy to use. I have to figure it out myself, but really, I mean, it was just a response in March when we had to pivot very, very quickly, and we had to find something that was easy to use. And so now we're just going to continue with that. There was, other than that, there wasn't really a lot more reason behind it. And like I said, at the time, the students hadn't all been migrated to Office 365 either. So.
Okay, yeah, I was just wondering because there was and still is a lot of privacy concerns with the Zoom software platform. So I was just wondering, like, with the native Google Meet in the actual everyone's software now, just why Zoom was a platform. But thank you for that.
Yeah, we've talked about the privacy issues related to Zoom, and some of the strategies that we've shared with instructors is to send out the link just prior to the meeting, so that this way it's not a perpetual kind of thing and people can't Zoom bomb or crash the site, that kind of thing. So that's one of the strategies. We've asked or we've suggested to people to send the invite directly through the email, the ULETH email, and not through any other emails that might exist out there, because the ULETH email really is for you and for faculty. That's not an easy email, let's say, to get a hold of. So there are some strategies, but you're right, there continues to be some concern there, and certainly Zoom as well has tried to address some of those privacy issues. So yeah, get it. We might, if we're at this long enough, we might end up going to Microsoft Teams. Who knows?
Okay, thank you very much for that.
Yeah.
Thank you, John. We have a student asking in the chat function, just to clarify, for example, Pub Health 1000 with Karina Zhu, it has a time listed. Would that mean we would meet Tuesdays and Thursdays 3 to 4:15 p.m. on the Zoom? I think, Monique, correct me if I'm wrong, but if there is a time listed in the bridge, that means that it is online synchronous delivery method. But again, it just, I'm not too sure in specific Public Health 1000. Currently, I don't have the list in front of me. But either it will be online synchronous or asynchronous. If there is no time listed, that means it's asynchronous. But if there is a time listed, then yes, students will have to be present in the Zoom during the mentioned times.
That's correct. That's the way the registrar's office is moving towards that. But again, just a reminder that the timetable changes may not have all been made at this stage of the game today. So just keep checking it, because the timetable might be reflecting what was pre-COVID time. But yes, if there is a time, like when we get close to the start of the fall, if there's a date and time, then that means that it's synchronous. And you know, if you're really not sure, feel free to reach out to those instructors and ask them the question.
Yeah, absolutely.
Sorry, Nimesh, I should have shared this. Is it okay if I show them really quickly what it looks like?
Oh, that's perfect.
So this is what you're talking about here. If the course requires you to log in at certain days and times, there will be a note on at the top of the listing, and it will say meetings will be scheduled during the days and times indicated, and is a day and time here. Whereas if a course is asynchronous, it will not have that note, and it will say TBA under time.
That is perfect. Thanks for sharing that, Janelle. Okay, we have a student asking, do we have any insight on what finals will look like this semester? Uh, it really depends on the course. If it's an online synchronous delivery, the final exams may be scheduled at particular time. If it's asynchronous delivery, instructors may decide to have the final exam but allow students to complete that within certain time frame rather than a specific time of the day. So I think it really depends on I think we are still in process to figure out on the final exams. Correct me if I'm wrong, Monique. But I think your instructor will provide that information, I'm assuming, would be the beginning of the semester in the course syllabi as well. And if you have any questions, I think feel free to reach out to the instructors of the course as well. If there are any final exams, first thing, and the second thing, if there are final exams or midterm exams, what times or how those exams will be implemented.
Right. Just expand a little bit on that. Generally speaking, what we are suggesting is that instructors who choose an asynchronous platform, so you don't have a specific date and time that you're going to log on, that if they have a final examination, that occurs within the course, and they will tell you, give you all the specifics about that. If the instructor uses a synchronous delivery format, they might choose to have an exam, a timed exam at a specific time and date and those sorts of things. The registrar's office will be setting up a final exam week, and so that's where it would show up. Other instructors, even though it's a synchronous course, they may have a different kind of approach for your final exam. They might say, I want you to write the exam over a 3-day period, but all of that will have to be explained certainly in the course outline. And once the registrar's office as well will be communicating how the final or the exam week will be occurring as well.
And I don't think we are using or going to use any Proctor software to implement or administer the final exams for the fall. So that is something that we have decided. The university has decided. So there will be no Proctor software exams. Any other questions?
Hi, I actually have another question I would like to ask. I'm just curious about like, do you guys have any information regarding if professors will provide like closed captioning for their lectures, or is that something that I still have to contact the accommodation office for?
That's a really good question. Yes, Monique?
That is an excellent, excellent question. And I have to tell you that right now, that has just started making its way onto the radar of the online teaching and learning task force. So right now, I can't answer that question, but it is on our radar. All I can suggest is that you might want to touch back with Nimesh a little later on in the summer, because hopefully we'll have some direction about accommodated learning. It's an excellent question, but I don't have the answer for you yet.
Okay, that's great to know then. Thank you.
Yeah.
Thanks.
And if I recall correctly, as we shifted very quickly in the spring semester as well, I did record some of the Zoom sessions, and I think the YouTube, when I posted those videos on the YouTube as well, it automatically generated the closed captions on some of the videos too. So so that was but the emergency. But once we have connect with me at the beginning of the semester or close to there, as soon as I have more information, we'll be very happy to provide as well. Thank you.
Okay,
Excellent
great.
question.
Thank you.
Any other questions? So we have a question. Do we have a timeline for when a decision will be made on when classes will resume in person? I realize that it's up in the air. Monique?
So as you can gather, as the Associate Dean, I've been involved in all kinds of meetings related to some of these questions. And right now we have no timeline at all. The university takes its direction from public health authorities, Dr. Henshaw and her team. And so right now, we don't know what the January term will look like. What I can tell you is how we start in September is how we're going to end. And it really doesn't matter whether or not all of the restrictions are lifted, let's say October 12th. We will continue on with the course delivery the way we started in September. And then after that, then if there are any changes, that will occur in January. But at this stage of the game, we have no idea. I know for me, I keep wanting to ask that question and people keep pushing me off. So, you know, once we know, we will definitely be communicating with all of the students and faculty.
Yeah, I would just like to mention that let's play our part, practice all the public health recommendations, and help us slow the pandemic. That way, we can probably be out there a lot more faster. uh, but yeah, we will. I'm sure the communication will come from the university as soon as a decision has been made. So keep checking your notice board. I think that's very important in this time. So absolutely, I recommend all the students to keep checking the notice board regularly in this pandemic as we move forward. Any other questions? Excellent questions. Okay, wonderful. Again, it's not that once we end the session, it does not mean that you cannot reach to us. If you have any questions, feel free to reach out to me, as well as academic advisors or any appropriate personnel if you have any questions or concerns as you join the university or the program. Again, I would like to thank everyone for joining today. It's pleasure connecting with all of you, and also I would like to thank our faculty, support staff, and Dr. Sedgwick as well. Be in the session and answer those questions and provide important information to our students. Thank you, everyone. I hope to, I'm very excited to see you all in the fall. And again, I'll connect with you for the orientation session as well. Thank you. Take care. Stay safe. And
Thank
yeah,
you.
see you.